This is CCTA case number 6. It is a 47-year-old man who has a history of high cholesterol and has developed some atypical chest pain. This is a single-phase examination. We'll begin here with the left main. The left main appears to be normal as we rotate around, see no issues with respect to that. Let's proceed now to the left anterior descending. There's clearly some calcified plaque in the proximal portion of the LAD, but this is not obstructive. Just distal to that area is an area of possibly mixed plaque, and if we concentrate particularly on this other area that's not a branch, this appears to be possibly ulcerated. Now the best way to check for that would be to compare CT numbers. This is clearly calcified plaque in the proximal segment, but this is a little bit different. Let's just check the CT densities. First of all, let's check the density inside the coronary artery lumen, ranging about 400, 399. Let's now move it over to the area of question, and we're seeing areas of about 370 Hounsfield units. So this is very close and would increase the likelihood that this is an ulcerated plaque that has now gotten contrast into the mural surfaces. This is a complex anatomic situation, but it is not obstructive. Remainder of the left anterior descending otherwise is normal. Let's proceed quickly to look at the other coronary vessels. Proceed here in the foot view. We're going to rotate up into the origin of the circumflex. We proceed down in there. There's clearly some, probably some focal remodeling. The artery is actually a little bit enlarged in this area of the proximal circumflex. There is some calcified plaque, but as we rotate around here, we can see that this is non-obstructive. An NPR view may help you appreciate this a little bit better. Clearly non-obstructive. Back to a 5 millimeter MIP. The remainder of this vessel appears to be generally normal. Let's take a look at the right coronary artery. Rotate around that vessel, trying to get it into a single view. You can get a little better look at this right coronary artery from the middle. This appears to be a normal vessel. We proceed down into the distal areas here. We can double click on that and hit a foot view, and we can see that there is a normal posterior descending vessel coming off in this direction. So what we have here is a 47-year-old gentleman who has atypical chest pain. There's no evidence for obstructive disease. However, he has mixed, possibly ulcerated plaque that's non-obstructive in his proximal left anterior descending, and he needs to be very aggressively treated for his risk factors, including treating his cholesterol.